Asterisk, yeah. Sure, it's just me. So I'm perfectly okay with these things.
All right. And the recording just started, so I'm just going to note, because we'll record this and it will be posted. This is the Metrics and Scoring Committee optional office hour. No decisions will be made. It's time for committee members to ask questions of staff. We don't have any agenda. And just so that you know, we're recording, and the recording will be posted on the webpage. So Manu, fire away.
I think someone named Ashley is here. Is she part of OHA staff or?
She is. I apologize. Yeah.
Okay.
Yeah. Ashley is our. She keeps everything running with the technology.
That's awesome. Okay. Well, hi Ashley. Thank you for getting us on board today. I think the first kind of question, and I know I'm not going to be here on Friday. So I wanted to take this opportunity to share a few different ideas that I thought about when I was reviewing the material. I think it was really neat for us to do the survey across the measure set to determine and assess kind of, how many of us are congruent and aligned with what the 2024 measure set would be and which of us kind of aren't. And I was wondering if we can maybe do the same for the benchmarks and the improvement targets.
We could do. We had the only issue is going to be timing. We did, goodness, not last. I don't think it was last year. I think the year before. What we did is had the staff benchmark recommendations come out, and then we had a survey of like, do you agree with the staff recommendation? Do you not? And if not, then they're like, and is it too aggressive, not aggressive enough, those types of things. And it was really helpful. The only issue with that is going to be getting the staff recommendations to you in time for you to have time to like complete the survey and then us to compile it and send it out to you. When we did that survey previously, it was when the benchmarking decisions were made later, which is not ideal. I mean, I'm trying to think of a creative way how we could do it. It's hard if you don't have something to react to, which is what I think is nice about having a staff recommendation, because it's like a number and you can say higher or lower.
Mm-hmm.
I could, let me think about what we might be able to do without that, or let me see. And I can also look, I have a timeline for when we're planning to get those to you. As part of it right now, we have finalized performance, and you saw at a high level the performance in the packet. And then what I was doing actually before this meeting was calculating all the percentiles and putting that in another document for you all to look at. And we as a team will look at all of those things and thinking through our recommendations. And we also consult with some of our subject matter and clinical expertise inside the agency. So let me see. We're getting it back from them on July 5th. The problem is there's not a ton of, sometimes there are 5 weeks between meetings. Not between this next meeting. Let me think about it. I'm just trying to think how we would squeeze it in, because if you have, well, we would have to have, I'm just kind of thinking out loud, when we would have to have, the meeting is on July 21st. We have our recommendations going to you a week in advance.
So can we have maybe the recommendations? Yeah, I was thinking if we can have the OHA records. So if we take this route, then of wanting a number to line it up against, depending on how we feel relative to that number, then if those recommendations can be put out 10 days before, or maybe 2 weeks before our next meeting, and then we would have to follow up with those survey responses, let's say call it 8 or 9 days after receipt. And then that would give time for you or the OHA staff to compile it and at least give us an idea of where that lines up against. So it'd be a more productive conversation. I'm sorry, Sarah, you're on mute.
I just see if I could somehow push up our recommendations to give 2 weeks, because realistically the most we'd be able to give you is a week with the recommendations, because we need to have materials to you and post them on the webpage for everyone to be able to look at, including your responses 2 days before the meeting. So that would mean we want things up by the 19th. Let me see if I can push it a little bit to try and get them out, to get our recommendations out to you potentially a week before what I was thinking. And then that would give you all a week, and then we would have a couple days to be able to compile everything and get it back to you.
Yeah. Would an alternate surveying approach be to not necessarily react to staff recommendations, but at least identify if we want to keep it the same or move up? I mean, it would be far better to have the OHA staff recommendations and we can react to it, right? So, yeah. Okay, so you think it might be a possibility then?
Possibly.
I may hold you to it. Just kidding.
I'd have to move up some other meetings I don't know. It's really tight getting our recommendations together, just because we want them to be thoughtful. At the minimum, what I'm trying to do too is the document that has like all of so what you had in your packet is pretty high level, kind of all of the performance. And then the other thing that we will have before July is it's the thing if you read through the benchmarking primer at the very end where there's like a picture and it shows the trends, et cetera. And having national percentiles and the percentiles from the CCO performance and all of that, and having that out to you all so that you just have more information, and having that out to you more than a week before the meeting so that you can kind of just sit and think through and look at some of the information that we're looking at too. Let's see.
So then maybe it would be good to for in advance of for the September meeting August meeting to review at the August meeting where everyone stands and sits. Because then it would allow for, I didn't realize those, additional things that would go into it like that. So perhaps there would be a discussion review at this meeting, and then we receive the information we review in July. What could be potential staff recommendations and maybe additional information that we would like to see to make a determination. And then we have a survey at that, which then would be consolidated for the September meeting to review with all the members.
You could. The idea is that the July meeting, you'll make it through as many measures as you can in terms of draft benchmarks, and then you would finish that draft work in August. And then that gives a month before you make final decisions in September for additional, just reflection on your part, but also additional public comment.
Okay. Do you think the idea of doing the survey is, I mean, to me, I think it streamlines things, because then it could focus our attention on areas that have the biggest gaps, much the same as what we did last month for the cigarette prevalence, right? Because we knew that that was the major, where we were most incongruent, we knew in advance walking into it that we were going to have more conversations around it. and then I could do my homework, for example, on the connections of oral health and overall health, to best inform the rest of the members from that perspective.
Yeah, I very much see the value of it. And I just don't know how much I can push up staff recommendations, because it's not just, staff recommendations are not just me, like they go up through a process. But let me try. I will try.
Okay. Okay, trying is all I could ask for then. I'll take it.
What else?
The next conversation of thought is going back to SDOH as postponing component 2, postponing component 2. And we've already made that determination. That's been finalized that it will be postponed, correct? Or is that still under review?
Correct. There was a motion, yeah, and you all passed it.
Okay. All right. I honestly, I feel like there's one other thing. Let me think for a second. I know we've discussed this before, and I don't remember the thing of it, but I think it was mentioned that we would have OFA provide a brief presentation to help all the members understand the QIM as it relates to as a bonus, as opposed to part of keeping the lights on, proverbially speaking. Is that set for August, or is that set for September?
July.
Okay, good. Next month. Perfect. Okay. Thank you for, kind of bringing that forward and kind of level setting. I think that's pretty important.
Agreed. Yeah. So Chelsea Guest, who is our director of, I'm never gonna get their actuarial and financial analytics, will be joining us.
Is there anything that I think these are the only questions that I had. There was something else. So with the HIE work group, this Friday we're going to discuss and review advanced population health metrics as it relates to the health information exchange so big picture. HITALK requisitioned a work group on health information exchange to provide strategic recommendations to HITALK, which then can guide OHA and legislature on what steps have been taken in the past, what's currently being done, and future steps as it relates to essentially 5 different concepts. And one of them is on population health. And that discussion within the HIE work group is taking place on Friday. And so during the co-chair meeting that we had last week, I believe that there needs to be a connection between what's being discussed and then ultimately presented to OHA through HITALK as it relates to population health, with review with metrics and scoring. I'm kind of an idealist, you know that already, Sarah. And so I believe that there's a connection. And so whether that connection is shared, with members, or at minimum, I think it should be shared with OHA staff associated directly with metrics and scoring. I think that would be really, really awesome to tie that in together. So I'm waiting for Justin. Justin Keller is I would say the connection between the co-chairs. I'm one of the co-chairs. Brian Wetters, another co-chair, and he is working on putting the presentation deck together for Friday. And so I'd like to share that with you, and you can circulate that. And if you can provide any feedback back to me by Friday morning, then I can ensure that it's a part of the discussion. Are you okay with that?
Sending to me this Thursday to look at for before Friday? I honestly may not have time.
Okay.
It is a, we're pushing payments out on Friday for the program. So it's kind of like our extremely busy week. Send it and I will do my best, but I cannot promise that I'll be able to look at it before Friday morning.
That's okay. Let me just see if he may have sent it and I overlooked it. I'm really good at that recently. Let's see, maybe
too many emails.
I do. I get a ton of. I'm sure all of you as well get a ton of emails, but I just feel like I'm getting slightly behind in all of it. So I was unable to find the deck, but I'm trying to go through my the high talk deck from last week, because we spoke at fair length about SDOH and different opportunities to how do we use, for example, how do we use Health IT to track SDOH data and the components of interoperability as it relates to SDOH across all the different providers that we have.
The other thing, even if I'm not able to look at it by Friday, is I can look at it after and talk with colleagues who are working on that measure as well. And then they might have a chance to review too and might have additional thoughts.
Okay, I think that would be really helpful, and I'll ensure that those thoughts will get integrated in the concept paper that we're looking at putting together. I don't recall the timeline for it, but I know that we wanted to finish all of the concept papers and recommendations to HiTalk by the end of summer. So that's the kind of the track that we're working with right now.
Okay, that sounds good.
Yeah, I'm sorry, I don't have that. I don't have that yet.
That's fine.
But thanks for your interest in how should I say this diplomatically to myself, in letting me be in my idealism, you could say, of how all these things are connected.
I think they generally are all connected. I am a sociologist by training, so I think lots of things are connected.
And I'm actually an engineer by training, so I think everything is connected. So, okay. Okay, perfect. Those were all the questions that I had and all the thoughts that I wanted to discuss with you. Is there anything that you would like to talk about?
Just a reminder. So the final set will be decided on Friday, and then a draft challenge pool set. So then in July, come ready, you'll hear about the financial piece to make final decisions on the challenge pool measures. And then it will be that first foray into benchmarking. If you have any questions in between, feel free to reach out and let me know. And I will see about survey, and I'll talk to the chairs too.
Okay, one last thing. So not last thing, sorry, but so I recall that on Friday we're finalizing the set. I got that. Are we also finalizing the challenge pool set as well on Friday?
Just draft, just coming up with the draft, and then you can think about it for a month, and then folks have time to public comment.
Perfect, good, okay. Okay, if we were doing the challenge pool set, then I I may have to have another conversation with Justin about not making the HIE work group because that's a kind of big deal that I would like to be a part of and facilitate that. But yeah, okay, perfect. Thank you for sharing that update of timeline and stuff.
That's good. So Ashley and I will be on for the next half hour. You are welcome to stay in case anyone else joins, or if you need to drop off, because I know you have a million other things, that's fine too.
Okay, perfect. Well then, thank you so much for your time. And as soon as I received the stuff for the advanced population health analytics, then I'll send it your way. Cool, awesome. Thank you. Take care.
Good. Thanks. Enjoy
Bye.
your afternoon.
You too. Thank you.
All right, Ashley, I am going to turn off my camera. If we have additional committee members join later, then I will turn it back on.
Sarah, do you want the recording to continue while we wait?
If folks join later, can you, if you stop it now, can you like put them together into one? Whatever is easier for you if anybody happens to dial in later.
Okay, then in that case, I'm just gonna leave it running, and then
okay,
if no one joins, we can crop it.
Okay, sounds perfect.
All right, thank you so much.
Hello. Hi, Manu. My teammate Katie Howard is joining us, and Katie knows the SDOH measure inside and out. So that's something you would want to talk about.
Hi, I'm sorry. I'm not sure when it came on. Do you mind repeating what you just said?
I said, my colleague, Katie, you're muted. My colleague Katie Howard is joining us, who knows a lot about a lot of things, including our SDOH measure, which is something I know you wanted to talk about.
Okay, perfect. So, did you? So Sarah, I just sent you the deck for the HIE work group for Friday. I'm sorry, Sarah, you're muted right now.
Keep doing that. I'm just forwarding it to Katie, and I'm conscious this is a public meeting that's being recorded. So I want to note for folks what we're talking about is a deck for a meeting that Manu will be chairing on Friday. The HIE work group. What is their full name?
Yeah, you're right. It's Health Information Exchange, or HIE work group.
The Health Information Exchange work group, and thinking through kind of connections of some of the incentives and metrics work around the social determinants of health.
Can you hear me?
Yeah.
Yes.
Okay.
Okay. So so Katie, would you like to go first, or should I just kind of start talking, I guess?
I don't know what we're talking about, so if you could go first. I just wanted to, my microphone has been really weird lately, so I just wanted to make sure in advance.
Okay. Okay, perfect. So what I can do is it possible for me to share my screen right now? Am I allowed to do that?
Ashley, is that technologically possible?
You should be able to, Manu. If you can't or something happens, please let me know, but everyone should be able to share their screen. Perfect.
Okay, perfect. Excellent. Okay, and let me go ahead and so I haven't looked at this deck either. It was just published right now. And this is a public document as well. Justin just published it publicly across the sphere, I guess you could say. Let's do a concurrent slide. And so, Katie, just to give you a little bit of a backdrop, the HIE work group, we've been meeting monthly since I believe November of last year, and we were tasked by the Health IT Oversight Council to provide strategic recommendations that can be reviewed by HITALK and then can be and then for review by OHA and by legislature in terms of the future of health information exchange, not only in terms of how it relates to providing health information at point of care, but then in addition to that, creating opportunities for closed loop referrals from provider to provider across not only the CCO model of care, but across all healthcare providers here in the state of Oregon. And so of the, through the work group we identified 5 different concepts that we wanted to dive into for further review and further discussion. And one of those, there was one on SDOH, which, is essentially what was determined, which is largely in line with what we're creating within metrics and scoring, is that a survey was sent out, and we're looking at identifying of all the different components that tie into social determinants of health, the top 3 that we would really look towards, how can we exchange health information are lining up with housing, nutrition, and transportation. And of course, this is very, very intentional because we know that within metrics and scoring, the STOH measure falls into these 3 buckets as well. So if at the metrics and scoring level, this is being driven, then in addition to that, the HIE work group and then HITALK will also be driven towards finding and maybe potentially investing in solutions that can create better opportunities for referrals by all healthcare providers outside of the concept of CIE, which is from one healthcare provider to a community-based organization. And so even though that there will be an achievement of interoperability from one healthcare provider to a community-based organization, and theoretically bidirectionally, that technology hasn't been developed yet, but there still is not yet an ability for the healthcare providers to communicate with each other around housing, nutrition, and transportation. So that's kind of where we are right now with STOH. I'm more than happy. I think I've already shared the PowerPoint, but as we look towards this other concept of advancing population, these are a few of the things that we'll be looking at digesting and discussing on Friday morning. And I was wondering if you can share, or if anyone on the call, including you two, Ashley, if you'd like to share your thoughts on, outside of the list here, are there any other population health activities that can also be reviewed or discussed?
Do you mean in relation to the social determinants of health measures specifically, or in relation to the incentive program?
Great point. In regards to population health, I mean in relation to the incentive health program, not just STOH.
So I also oversee the EHR metrics. So a health information exchange, I just want to make sure that I have the right definition. It's EHR interoperability. So different EHRs would be able to communicate with each other. Is that the definition that I'm seeing in the slides?
Yes, that is the intent of health information exchange, is that different certified EHRs have the ability to communicate with each other.
Okay, so I mean, I have talked to Susan Otter and Lisa Parker, and I'm working closely with them about kind of the future of EHRs and what that potentially looks like. And I think we talked about at one of the metrics and scoring committees, Courtney had asked about when would the state have member level data for electronic health record measures. So that would be depression screening and follow-up, diabetes for control, the cigarette question, or the cigarette measure, prevalence measure, and then SBIRT, substance abuse prevention. So right now, how I get those data are at the organization or practice level. And so eventually, we are hoping to engage a HEDIS vendor who would create FHIR compliant API and be able to accept data in from different organizations that are serving Medicaid patients and put it into a database that would be integrated into our data system so that we could join it with RealD data and other MMIS data, as well as calculate the EHR metrics at the member level. And then it kind of like, and it would be the same, it would be a very similar analytic structure to what we currently do for the administrative or claims-based measures that is probably like 5 years away. And so that's, I think we're planning on the incentive programs for where we're going so that we can get EHR data at the member level, because really, without it, it's very hard for us to see the full population, right? Because with the EHR measures, we set a threshold and we say, you need to provide EHR data for this measure on this percentage of your population, so it's never full population. So I think, and CMS is really going in that direction of feeling like EHRs are where we can see a lot of the outcome and not just the process. Although, you know, that's a gray area. You can sometimes see process for sure in the claims data measures. So I'll just stop there and see if you have any questions.
Yeah, no, this is very, very helpful, and you're definitely a diamond in the rough as it relates, because of your breadth of what you oversee with EHR measures. That's so awesome that we have this opportunity to connect like this. In my my non-volunteer role, I serve as president of Capital Dental Care, and I used to practice dentistry as well. And so as you connect and speak about EHR measures, as we all know, there's no dental provider organization in the state of Oregon that is on a certified EHR. And so as we look at folding into and advancing other concepts beyond the current oral health measures, have you discussed internally about how we can try to bring dental provider organizations, behavioral health care provider organizations, and even smaller physician practices to the table as it relates to creating that golden bridge that allows us to understand really that real-time member level data that you speak about?
I don't know how you would bring along some of the smaller providers, because I think, and we just have 1 minute left, some CCOs have contacted me and they just have providers that that are still using paper records. And so that just is not gonna, we're not gonna accept paper data. I think we will be doing requirements gathering for the vendor starting once we know what's going on with the budget and the legislature. And so things are just pretty up in the air right now. We have not started requirements gathering for the RFP, but I think that's, you know, I know you brought it up before in metrics and scoring, and it's definitely something that we can have as part of the requirements gathering and have conversations with Lisa and Susan about it.
I completely agree on a consumer personal level that we should be driving towards EHR data at the member level. I'm just trying to get from point A to point B in the best way possible. So, yeah. But that's so great that the conversations are already being had. As far as I know that we're already up in time right now, but if you don't mind reviewing this document that Sarah has circulated with you as well, and if there's anything you see that would be important for the HIE work group to review and discuss as we build this out, you know, please freely share it with me, or so that I can inform the group.
I've talked to Hope before, and so the staff who's on the committee is aware of our perspective on where we want to go and the HEDIS vendor. So I really feel like I have made that connection, just so you know. And
okay,
I can take a quick look, but I really trust that team, since I do think that I rely on them for a lot of my knowledge. So I'm not sure how much I would have to add, but I can take a look.
Okay, and Luke is the primary OHA staff member associated with the HIE work group. Hope is more for the greater High Talk. So just calling
I
that,
think I
that
met with
distinction.
him. Yeah. Did you
Okay.
say Luke?
We
Yeah,
met
Luke.
with Luke briefly.
When I met with their office, there was like 10 people. So I think they're very well informed.
Okay, perfect. Excellent. Just wanted to make sure that we're all connecting the dots. Thank you very much for your time, and I realize we're at time.
No problem.
All right.
All right. Thanks,
Thank you.
everyone.
Goodbye.
Okay,
Yeah,
thanks.
thanks.
Bye.
All right.
Bye.
Bye, everybody. Good afternoon. Thanks, Ashley.